Hello, my name is Iihan. I received a heart transplant 19 years ago. I had a childhood disease, basically strep throat, that caused destruction in my heart valves. Eventually, it led to abnormalities in my heart muscle as well as conduction system. So uh, I came to a point where my own heart couldn't sustain my body anymore, and I was referred for a heart transplant. Since my transplant, I became a totally different person. I was not able to continue my work before the transplant, hardly able to maintain my daily activities. And after the transplant, I went back to being a full time surgeon until I got some problems with the late effects of the transplant. The most challenging part of my transplant uh, journey was actually from the time period waiting for the transplant period because of my heart disease's nature. I had a lot of irregularities of the heartbeat resulting in fibrillation, and I had an implantable defibrillator. At that time, I was being shocked by the defibrillators, sometimes several times a day, which actually they were very disturbing and scary. Uh, when I had a transplant, and all the times afterwards, for years, I had no issues with the transplant. That part of the transplant journey was basically a walk in the park. It helped me to stay hopeful while waiting for the transplant is the fact that uh, my belief that my disease was terminal, and if there were any remedy to it, it would be a transplant. And no matter how badly I felt, I was looking for the day of the transplant. Since my surgery to get well and stay healthy, I've dedicated myself to my job and family, uh, and did not think about my disease anymore. I continued with some exercises, sporting activities, as well as hobbies, and went on travels, anything that anyone with good health would have done. And I did not have any troubles performing those activities. My recovery from the transplant surgery was uneventful. Uh, I kept up with my daily walking exercises for months, and at some point, I start to feel well enough to make me think to go back to work, and that materialized almost 19 years, and I had many years during that time where I was able to contribute to the society by performing my job as a surgeon. After so many years, caused by or contributed by the anti-rejection medications, I developed lymphoma, and that required chemotherapy as well as other treatments. And that was the worst part of my transplant journey. To those who are going through transplant evaluation or waiting for the transplant, I would advise to be very hopeful and expect a great change in your lives. Trust your teams in managing your situation as best as possible, and wait for the better days.